The act of debriefing is a model of good surgical practice that has been adopted by high-performing institutions. It provides an opportunity for all those involved in a surgical case to identify the elements that were performed well and the aspects that could have been improved. The purpose behind this activity is to increase safety as well as develop open communication and teamwork. Here's an example of the Loma Linda University Health post-surgery debrief. Andrea, are you good to complete?
Yes, Doctor.
Okay. All right, everyone, let's plan our post-operative debrief. Let's confirm the procedure that we did today. We did a right total mastectomy with a sentinel lymph node dissection. Does our records reflect that?
Yes.
All right, and can I confirm the counts are correct?
They are.
Okay, and let's confirm our specimen.
The specimens that I will confirm with you are specimen A, right breast mastectomy. Orientation is short stitch superior, long stitch lateral. And specimen B, 2 sentinel lymph nodes. Both of those specimens are for permanent.
Perfect. Anesthesia, what's our estimated blood loss?
200 cc's.
Perfect. What fluids did we give?
So we did 1 liter normal saline and no blood products.
And how did the patient do?
Patient was stable. No vasopressors were needed.
Thank you, everyone. I think we did a good job during this case. We were very efficient. However, I would like us to work on making sure we have all the right instruments at the beginning of the case so we can start on time. Just to help you with that, our next case is going to be a left shoulder sarcoma resection, so we are going to need the beanbag for positioning. I will plan on being here in 30 minutes. At this time, I'm going to do my postoperative documentation in the operating room. After discussing the positives and negatives of the completed case, it opens the floor to input from any of the other team members. Once everybody has had a chance to speak, take some time to prepare for the next scheduled procedure with the team. This keeps everybody focused and collaborative. Additionally, a key component of surgeon documentation is performing operative documentation. Per JACO, documentation must be in the chart prior to moving the patient to the next level of care. If the surgical team accompanies the patient to the next level of care, PACU or ICU, the operative documentation can be completed there, provided that during the debrief, this is documented by the nurse. In conclusion, option 1 is completing the brief post-op note before leaving the OR. Option 2 is completing the typed operative note before leaving the OR. Option 3, for those who dictate the operative note, the brief operative note must be completed before leaving the OR. Option 4, if the surgeon wants to do this documentation in PACU or ICU, the surgeon during debrief lets the nurse know that they will perform their documentation in the PACU or ICU. The surgeon must accompany the patient to that level of care and perform the appropriate post-op documentation. When the surgeon has a case to follow, setting expectations and providing pertinent information for the next case shows leadership and accountability in the operating room.